Emergency room nursing. Now I know a lot of you guys have been waiting for this video. So some of the great characteristics of an emergency room nurse is going to be independent thinking. So when you're in the emergency room, it's not made for everyone. When you're in the emergency room, you have to think like you're the doctor, because when you think about it, when the patient gets off the ambulance, the first person they see is not the doctor, it's the nurse. I've had patients for about 2 hours before the doctor has even seen the patient. So what does that mean? That means that when they come in, yes, you should be able to detect if that person is having a real emergency. Because despite what Grey's Anatomy or other TV shows may say, the doctor is not there at the bay waiting for the patient. That's just not happening at most hospitals. And so you really have to have the skills to say, okay, this person's having a stroke. I need to, this needs to be handled emergently. Or when you go to triage, there's no doctor out in triage either. It's all about the nurses deciphering if this person is sick or not. So pretty much your assessment skills need to be very well, because your assessment skills are going to be determining whether these people are being seen, whether they've been having a stroke for the last 30 minutes and you didn't determine that. Sometimes, depending on the doctor, if they're really busy and they didn't get around, they'll say, oh, why didn't you order a chest x-ray? Why didn't you do whatever? So you're held a lot more responsible for ordering stuff. There's a lot of protocols in the emergency room. On the floor, it's like you're waiting for the doctor to give you an order for everything. You don't do that in the ER. You don't wait for a doctor to give you a lot of certain basic protocol emergency room orders. So I will say that your assessment skills, you have to be able to do a very rapid assessment, a very rapid, thorough assessment. Know what you're looking for, things like that. So that's a main part of the ER that's very different for people, aside from the speed, because when you work on the floor, which I used to work on the cardiac floor before I went to ER, so I kind of have experience on both sides. And on the floor, every little thing you needed, you have to call the doctor. We don't do that in the ER. Most things that you do, you kind of do on your own, and then if you need the doctor, they're right there, and you just ask them. So it's just a lot of independence, a lot of autonomy, and then a lot of multitasking. So if you don't work well in really fast environments, where people are doing many things at once, then ER is going to be hard for you too. So for example, I may be hooking them up to the EKG machine, another nurse is starting an IV, another nurse might be putting down an OG tube. Nobody's saying like, I'm sorry, can you please wait to finish that EKG? So like, no, we're all doing this at the same time. And and if you don't let us all do it at the same time, we're going to get annoyed with you, because we don't have time to let everybody go individually. And it's literally an organized mess. Like, we all know what we're doing. Everybody knows what their, title is, and they're focused on it, and they're doing it. There's no confusion. Everybody knows that when the EKG is finished being set, we'll stop harassing the patient so that they'll be still for the EKG. So it's a lot of stuff going on at once. Another thing about ER is you become the jack of all trades. So that's awesome, because you get to see many different types of patients. So you may get an OBGYN patient. You may also have a neuro patient. You may also have a cardiac patient. You may have a surgery patient, a GI patient. So that's cool, because you get to get many different illnesses and get very familiar with all disease processes, and especially if you have a pediatric ER also, you get peds, you get kids. I mean, the sky's the limit. You can handle almost anything, as opposed to working, on a cardiac floor, on a neuro floor, on a surgical floor. You're getting everything. You can pretty much handle almost anything, because I've had times where I've had a patient in each category. I've had an OB patient at the same time of having a GI patient, at the same time of having a cardiac patient. It's pretty cool, because you keep your skills all really, really up to par on different patient varieties. The problem with that is that you never really become an expertise in one area, which is why I say, I'm not saying new grads can't start in the ER. We do get a lot of new graduate nurses in the emergency room, and many of them work out to be perfectly fine. But I will say that it's best to not start in the ER. One is for that reason, you really want to be an expert in at least one thing. You don't want to just be jack of all trades. Because when you're jack of all trades, you really never understand what happens on the other side of the spectrum. And when you see what happens on the other side of the spectrum, it gives you a better view, like in the ER. So when I worked cardiac, I used to get the patient, and I used to know that this cardiac patient is going to get troponins Q8. And then we would see that. We would do the troponin and cardiac enzymes every 8 hours for 3 sets, and then we'd do the stress test in the morning, send them off, get them back, open heart surgery, chest tubes. You were seeing what was going on. So when I go to the ER and I get a cardiac patient, it's like I already know how to work up the cardiac patient because of where, I used to work. And it gives me a huge understanding and a huge upper hand on all cardiac emergency room patients, because there's certain medicines that I'm very familiar with that I used when I worked on the cardiac floor that many other emergency room nurses, like a lot of ERs don't use hydralazine. But when I worked on cardiac floor, that's all we used was hydralazine. A lot of doctors like to use labetalol, but when the heart rate is 50 and you don't want to use labetalol, and the doctor's like, well, what else do you want to use? You can say, hey, how about hydralazine? And that actually happened to me before, where I was able to suggest to the doctor to use hydralazine, a newer doctor. And I only had that suggestion because I worked cardiac. It just gives you a better understanding of how things go other than the ER. Because in the ER, you only see, the beginning. You don't really see the rest. So if you really want to be a complete and competent and thorough nurse, I would say it would be best to start on some type of floor, even ICU, before ER. Not to say you can't do ERs in new grads. You can. Like I said, I have the person who precepted me, who taught me how to be ER nurse, she started out ER. She never worked anywhere else. So of course you can be a great nurse, you can be a successful nurse, you can be wonderful and only do ER and start in ER and all that stuff. I'm not saying it won't work for you. I'm just saying to have a more thorough mindset, if that's what you want. If you don't want a thorough mindset, if you don't want to have that really good foundation and baseline, then whatever. But I do believe that working on a different unit first gives you a stronger baseline. And other nurses agree as well. My employees, we talk about it, and other ER nurses, they'll say, oh, well, I kind of wish I worked on a different unit first so I can kind of have, seen what it was like or whatever. So it is kind of nice, to work somewhere else before the ER. Teamwork makes the dream work. It does. Teamwork makes the dream work. And that is very eminent in the emergency room. So teamwork in the ER is so incredibly massive. I mean, even when you're done with your work, you're not done with your work because your other nurses need your help. There's always a turnover. The moment you get someone in your room, you're getting someone out of your other room. You can see about 10 patients a day. A lot of people don't like that about the emergency room because they like to get their patient tucked in and then be good for the rest of the day. Nope, not in the ER. Continuous process. You get them tucked in, you get them picked out. Tucked in, admitted, keep it going, keep it going. The nurses upstairs hate us because they think that, like the floor nurses and stuff hate ER nurses because they think that, like, I don't know what they think we're doing. Well, I do know because I used to work up there. They think we're, like, holding our patients or something until we send them up, but I will say that that's not the case. And I used to think that too. I used to hate ER nurses when I worked on the floor. But teamwork is massive in the emergency room. In nursing school, you learn a lot about multidisciplinary care. And you use that a lot in the ER. Respiratory therapy, doctors, nurses. You really work as a team. Like, it really is a team effort. And you really feel like you're a part of a team. And that's something I really like about working in the ER. Can you pay my skills? ER skills. So when you work in the ER, your skills are one of the things that need to be very diverse because we can do anything from starting IVs to OG tubes to Foley catheters to straight cath to putting a cast on to delivering a baby to just doing a bunch of random things. So not to make you nervous because, I mean, you learn these skills while you perform in the emergency room, but you obtain the most random and diverse skills ever working in the emergency room because on certain floors, that's something that makes me so mad because teachers and a lot of people in nursing school, they make it seem like you have to work on med-surg to get med-surg experience. Every floor has a little bit of med-surg in it. So it doesn't matter where you go, you're going to practice certain med-surg things. I mean, unless you go like to labor and delivery or something, you won't practice it as much. Because many times, you know, labor and delivery, you're a mother baby. The mother may not be sick, they're just delivering a baby. But in the emergency room, you practice tons of skills. I mean, skills galore. So that just keeps you on your toes, keeps you, you know, you use all your certifications. ACLS, BLS, and all those things become so easy to do because you're doing them every day in real life anyway. Alrighty, so I will end this emergency room video by saying an ER nurse needs to be able to do rapid assessments. An ER nurse can be a new graduate nurse, although I don't recommend that path, but you know, you can still be successful. An ER nurse should be able to multitask, and an ER nurse should be great in their skills and love teamwork. ER nursing is very fun. It is totally not for everyone. And most nurses that are ER nurses have a very light-hearted personality. They don't freak out over a lot of things. And they're pretty calm. It's pretty funny. That's how ER nurses are. ER nurses are awesome. And that's all I have to say about it. Also, emergency room nurses are statistically at higher risk for PTSD, post-traumatic stress disorder, anxiety, and GI bleeds, ulcers, stuff like that, due to the higher stress level. You can't be judgmental in the emergency room. You do face a lot of ethical dilemmas. You have to take care of people that abuse the system, people that come to the ER every day, people that are not really sick, people that should stay at home and drink some soup. You can't be judgmental. You literally cannot be. You just have to take care of everyone. Sick is what the patient says it is. Pain is what the patient says it is. Seriously, I know I'm laughing, but I'm serious. So you really just have to take your judgment out of it. If your patient says the pain's a 9 and they're having the worst abdominal pain of their life, they could be having a rupturing appendix. So take their word for it. So ER nursing is great. Be very careful with it. It is stressful and it is very emotionally turmoiling. I will say that. But I love it. Anyways, guys, if you enjoyed this video, go ahead and hit that like button. Don't be afraid to comment and let me know what other videos you would like to see. And stay tuned because next time you see me, I will be in my next nursing assignment. And stay tuned to see where that will be. See you later, guys.